To solve the healthcare crisis in 2 minutes, I'm up for it. The policies I would support are bringing more free market initiatives into healthcare. My dad was a physician and he had his office in our home. And my oldest daughter is a physician and the chief resident at a hospital back in Waukesha, Wisconsin. This is an issue that's been very dear to my heart my entire lifetime. I watched my dad as he had a true family practice, patients who were grateful. And he knew who deserved a handout and who didn't because he was there with them. He knew that if somebody in the family was ill, he treated the entire family and not just that one individual. And when he passed away last year, I inherited from him a diary of all the children he had delivered. And he was only paid for 2 out of 3. The others he never even billed for. That was the kind of health care that had caring as a part of it. And our government does not have health care to give out any more than it has corn under Capitol Hill or coffee or cars. All our government does is interfere in the health care marketplace. Over my lifetime, the largest factor driving health care costs up has been complying with federal rules and regulations such that my daughter today would never consider hanging a shingle out and opening an office and being the kind of practitioner that my dad was. Instead, she needs to join a practice with a full-time staff of people that deal with the onerous and exceedingly costly regulations that she'll have to comply with. When I was earning my MBA in finance, I called up my dad and said, "Hey, Dad, how come you're retiring?" He was selling the house and closing up shop when he was still in his 60s. And he said, "Joe, I feel like I've been turned into a half-time physician and a half-time accountant for the federal government." When you take physicians and require them to do that or require them to have staff to do that, that's the key that's driving up the cost of health care. And free market reforms are what will bring costs down, nothing else.
Thank you. Mr. Bennett.
Free market reforms come up a lot when we're asked about health care, and I think my Republican opponent will probably say something along those lines as well. Free market reforms are essential to be able to bring down health care costs, but free market reforms only go so far. In 2011, when my oldest daughter was then a student here at Eastmont Middle School, we took a skiing trip up Solitude Mountain, and she took a wrong turn. And she tumbled 300 yards down the side of the mountain, head over heels. And she blacked out, so she doesn't remember when she came in contact with something, but she hit a rock or she hit a tree, something that gave her a burst fracture in one of her vertebrae down at the bottom of her waist. And it left her paralyzed from the waist down. And when we rushed to the emergency room, we were not in a position to deal in free market forces to determine who would be the lowest cost surgeon, which surgeon had the best resume. We were just anxious to make sure that we had a surgeon that could make sure that my daughter would be able to walk again. My daughter can walk again. She walks with forearm crutches. If you saw her, you'd think maybe she had sprained her ankle. But she will always have some, but we will always be grateful to the surgeon that gave her that ability. And the free market wouldn't have been in a position to be able to pick that surgeon for us. So as I look at health care, I think that it's essential that we find ways to introduce market forces for things like common checkups. But catastrophic coverage ought to be available to everyone to make sure that anybody facing the kind of circumstance that we faced in 2011 will have the resources to be able to deal with that effectively. I think health care is one of the most important issues in this race, and I'm disgusted that both sides are bickering about it rather than working to solve the problem, which is what I want to do when I get to Congress.
Thank you. Dr. Allen.
I've spent my entire life in healthcare. Even when my dad practiced, I was his janitor, his medical assistant, his secretary, etc. So for the past 50 to 60 years, I can testify the free market does not work in healthcare, and it never will. It's because healthcare is not a commodity. It does not behave like a commodity because it's based upon urgent need. It's not based upon desire. And by that I mean that if you have a similar situation to what Jim said, you get that horrible call from the emergency room that your relative is there. You are not going to sit there and shop. You are going to go to your child's side and be there and do anything you can to save that child's life. That's one way that the healthcare does not fit the market. Another way is somewhat counterintuitive, but we need to understand it, and that is that best quality health care that follows practice guidelines and emphasizes prevention, early detection, and early interventions of disease costs less than the way we do it now. We have Dr. Joe Jarvis that gives healthcare town halls for us, and I tried to figure out a way to encapsulate his 40-minute PowerPoint show that demonstrates all of this in great detail. But it's not possible to do a subject this complex in a short amount of time. I would like to say one word about health savings accounts, because I've heard that mentioned as some kind of solution. It doesn't address access, and it doesn't address cost. Everyone needs health care. Everyone deserves health care. And we've got to find a way as ingenious Americans to get that done.
Thank you. Mayor Curtis.
So I hope as you go away tonight, can you hear me? Is that on? Thank you. I hope as you go away tonight that you'll notice a clear difference, and particularly on this issue more than anything else. This is a question about more government involvement, more government mandates, more government making choices for us, and whether or not that's the path we want to continue down or whether or not we want to reverse that. This is an amazing time in healthcare, because when we go to the doctor, we're more worried about the bill than we are about the diagnosis. I believe it's a mistake to lump everything into one category of emergencies or emergency care. I don't know anybody that doesn't want to see a safety net in our society. I don't know anybody that doesn't want to make sure that when those emergency comes, if we don't have adequate resources, that we're not covered. But you know, in the last 2 years, I lost both my mother and my father. The number of choices that we had along the way were legion. My father was faced with a doctor who suggested surgery for his heart. He decided not to do it because the risk was so high. He was in his 80s. He waited 5 years and was faced with that choice again and decided to do it. And we lost him 6 weeks later. We had choices about which doctor and which hospital, which procedure. When we lost my mother, we had choices between hospice care in the home or hospice care in a facility. All of those things are decisions that need to be made with the most amount of information possible without somebody telling us what those decisions would be and limiting our decisions based upon which doctor we have to see. It's clear, the more government involvement, the higher the expenses, and the longer we wait for service. We see that wherever we go. I'd like to see us initiate many good ideas. I can hardly talk to anybody who doesn't have good ideas. We just need to move them forward. Thank you.